Hi, I'm Dr. Peter Lynn. I want to talk to you today about thyroid conditions. Really, there's about 20 different thyroid conditions. I want to talk to you about 3 of the most common and the most important ones that we see, and you may be one of them. First of all, the first one is called hypothyroidism. This is a lack of hormones related to the thyroid that are supposed to do its job. Some of the symptoms I'm going to read to you, and you may have some of them. Fatigued and just tired, requiring more than a full night's sleep, just not getting much rest, cold hands and cold feet, weight gain that's easy, you gain weight throughout the whole body, difficult and infrequent bowel movements, depression, lack of motivation, mental sluggishness, the brain's just not working as sharp as it used to, morning headaches that tend to disappear towards the afternoon. One of the biggest problems is thinning of hair. Actual clumps of hair begin to fall out, and a real telltale sign of hypothyroidism is the outside of the eyebrow begins to disappear. So these are the symptoms of hypothyroidism. The other type of thyroid problem is called hyperthyroidism. This is an actual increase of the thyroid hormones and their utilization. It's also called Graves' disease. You get an inward trembling as a symptom, rapid heart rate, pulse rate, just everything's hypermetabolized, nervousness, emotional, insomnia, night sweats. These are the symptoms of hyperthyroidism. The third type of condition related to the thyroid is Hashimoto's thyroiditis. And this really is more of an immune problem than a thyroid problem, but it affects the thyroid. And this is where most thyroid conditions go undiagnosed and are mismanaged. You have to know the kind of thyroid problem you're dealing with. Or for that matter, you have to understand the body's processing to understand the problems you're dealing with. So let me just, I'm going to go through here, but my name is Dr. Peter Lynn, and I've been practicing wellness chiropractic with an emphasis on metabolism problems since 1988. And the reason I got into this is I see more and more people over the years walking around with these symptoms that are just mismanaged, they're frustrated, they don't know what to do, they're on medications that just are not working, and I found by looking at histories and understanding diagnosis of laboratory work that we can really find out what's going on, apply the appropriate care, and get the person under control again so they can live their life without these horrible conditions and symptoms. First, a little bit about how the thyroid works. One of the markers that's done in traditional medicine is a TSH. You've heard of a TSH marker. What it is, it's the pituitary gland in the brain produces a hormone called thyroid stimulating hormone. That tells the thyroid to begin to produce thyroid hormones. So if that's working right, we have no problem. But if the TSH is real high, we know we have a thyroid problem because the thyroid's not doing what its job, so the brain produces more TSH. So when you get a lab result back with a high TSH, we know that the thyroid is not working well. But it may not require direct intervention to the thyroid. Let's keep going. Once the thyroid gland gets the signal from the pituitary that it needs from TSH to produce thyroid, the thyroid gland produces 2 main hormones. One is called T4, which is about 90% of the thyroid hormone. The other is T3, and that's about 7 to 10% of the hormone related to the thyroid. Now, interestingly, T4 is not utilized by the body. It's inactive. So it has to convert from T4 to T3, and it does that in the body tissues. So we've got a thyroid problem, but we may not have we have a conversion problem, and that's maybe it's in the gut. The gastrointestinal system is not converting it, where a lot of T4 conversion to T3 takes place. So what I'm getting at is we have adequate amounts of thyroid coming from the thyroid gland, hormones coming from the thyroid gland, but we have a problem in the body that it's not converting correctly T4 to T3. So they're named T4 because of the iodine molecules that are attached. There's 4 iodine molecules on T4 and 3 iodine molecules on T3. So this is a process of utilizing iodine. Now they used to think when they started putting iodine in salt, they call it iodized salt, that would have a good effect on the thyroid gland. And it does if it's a true hypothyroid, but if it's a Hashimoto's thyroid, this will create even more problems. So you've really got to know what kind of thyroid condition you're dealing with. Back to thyroid, Hashimoto's thyroiditis. The body produces antibodies to antigens that we eat over time. So over time, our bodies are producing antibodies to take care of the foreign antigens. And the reason I know a lot about this, I wrote a book called Barren Harvest, and it's about genetically modified foods. And the problem that is these foods are foreign. Our bodies have never seen them. So over time, the amazing part of our body is they recognize these foreign proteins as foreign and they want to get rid of them. They want to clear them out. But over time, what begins to happen is these antibodies begin to attack our cells, our organs and glands, and particularly thyroid. So when we run a test on people, we can actually test the antibody levels, and some of these people are just off the charts with these antibodies. And we know that's a raging thyroiditis or Hashimoto's disease, but it's an immune problem. You've got to get the immune system under control. So what I'm getting at is we have to do multiple tests. You can't just do one test and call it good. You've got to see how blood sugar relates to the problems. You've got to see how the gastrointestinal system relates. You've got to see how the kidneys and the liver work together. You've got to see lipid panels. So when we run a test on somebody related to some of these symptoms, we want to see the gamut of the body processing. Because if we've got a thyroid problem, we know we've got multiple other areas, and we have to find out the priorities that we're going to deal with and work with. So you can see that the thyroid condition is more than just the thyroid, it's the whole body. And so what we want to do is find out as much as we can about the person, get the appropriate diagnosis, and get the appropriate care and management of these people, and get their life back to normal again, reduce these symptoms, and get them on the back to the road of health again. So I hope you've gained a lot of value out of this information. If you need any more, please call our office, or we'll talk to you in depth and find out what we can do to help make your thyroid and your whole life a better process. Thanks for watching.